Did you know that 64% of all traumatic knee injuries in basketball are ACL injuries? That's a very huge number there, and we're going to explain why ACL injuries are very common in basketball players. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So for today's video, we're going to go over why these ACL injuries are very common in basketball, and we're going to give you every single reason and the explanation of it. All right, the first reason is that basketball, as we know, is a high impact sport, meaning it's not like swimming where you're just swimming and you have no impact on your joints. You're actually running, it's fast paced, and the way that basketball is played now, there's so many points being scored because people are running back and forth. So when you have all that impact, you increase your risk for those ACL injuries, especially because we have these rapid change of direction movements. So it's not just running in a straight line, you're playing defense, you're going side to side, you're cutting. So all these high impact rapid movements increase the risk for ACL injuries in basketball. The second reason is a very common one, and where we see a lot of ACL injuries occur, is the jumping and the landing. Basketball is very unique, that involves a lot of jumping, and when you jump you have to land, and this is where we have these injuries, when we're landing in an awkward position, where we're landing on one leg, our knee comes in, or we land with another player and our knee comes in or hyperextends. Because there's so many players on the court at the same time, especially in a small space, especially if you're driving in for a layup and you land awkwardly, that increases your risk for ACL. The third reason, which you see all the time too, that basketball involves a lot of cutting and pivoting. So when you're having the basketball, you're changing direction, you're cutting, you're playing defense, you're cutting and pivoting, and you'll see people when they do the Euro step where their knee gives in, and that's where they tear their ACL. So basketball involves a lot of these fast, rapid cutting and pivoting movements, and sometimes the body's not ready for it, and that's what may lead to that increased risk for an ACL tear. Another reason why basketball is such a high risk for ACL injuries is because of contact injuries. So when we talk about ACL injuries, there's the contact and non-contact. If you want to learn more about ACL injuries, click the description below. We have a good ACL video on what an ACL tear is and how does it occur with this contact and non-contact, but I'll give you a quick summary. So contact is when someone bumps you and your knee comes in or hyperextends, or there's some twisting mechanism which leads to the ACL tear. And it's not only where right before you're about to take off, but let's say you're going up for a layup and the guy bumps you in midair, and that causes that awkward landing. So that's still considered a contact injury because there was contact and then it forced you to land. Non-contact is more the two previous reasons, where you land by yourself and you land in an awkward position, or you're cutting and you get in an awkward position and you tear your ACL. So all those previous reasons that we talked about, fast paced, jumping and landing, cutting and pivoting, and then now you add in, because there's players guarding you physically, that contact aspect, so that just increases the risk for that ACL injury as well. And now we're going to go over some reasons that are not straight directly related to basketball, but these are more internal factors, that you kind of increase your risk for ACL tears because of your actions. So the first one is not warming up properly. A lot of weekend warriors, also sometimes at the high school level, but you don't see that as often, but more weekend warriors where you're gonna go play pickup, recreational league, and you just show up there and your warm up is your first quarter. So that will increase your risk for ACL injury. Studies have shown that a proper warm up will decrease your risk for ACL injuries, warming up properly, so that way when you're on the court, you've already warmed up your muscles, you activated your muscles, and you're ready to go into those movements, as opposed to just jumping into it and then you jump or you try to do a cut and you're not warmed up, and then you're having an awkward landing, and that increases your risk for an ACL injury. Another internal factor is fatigue. So monitoring your fatigue levels, because fatigue does increase your risk for ACL injuries, because then it leads to altered biomechanics. So we're not just talking about fourth quarter overtime fatigue. So let's say you're playing and by the end of the game you're fatigued and you don't want to sub out and you want to keep on playing. That might increase your risk because your movement gets altered because you're tired, but also just overall fatigue. Let's say you had a long work week, or you've been playing multiple games every day and it's game 7 on the 7th day, or maybe it's 4 games in 2 days, but just overall fatigue of your body, and your body's not ready to perform at its normal level, but your brain is trying to force it to do that. That's what we lead to those altered biomechanics, and then increases your risk for ACL injuries. And the last reason is coming back from an injury too soon. So it could be either an ACL injury, so if you already had an ACL injury and you want to go back to basketball and you go back sooner than 9 months and you're not ready, that increases your risk for an ACL injury, especially in basketball. But the other thing is just like a simple ankle sprain or a jumper's knee. Any injury that's not fully recovered and you're not really ready to go back to sport, and that leads to compensations and altered biomechanics, and that overall increases your risk for an ACL injury. So hopefully you guys learned about some of the risk factors why ACL injuries are so prevalent in basketball. I mean, you see them all the time, and we're not trying to scare you from playing basketball. We just want to show you guys why we are at risk for ACL injuries. And just to kind of summarize them: one, basketball is a high impact, fast paced sport, involves a lot of jumping, landing, cutting, pivoting, and also there's contact involved, player guarding you, and that's where a lot of these injuries occur. And then also internal factors like you're not warming up, or you're fatigued overall, and you might be coming back from an injury too fast, too soon. But these are all risk factors for ACL injuries when you're playing basketball. So as long as the biggest things, takeaways we tell people: warm up properly. The things that you can't control, like we said, those contact injuries. So warm up properly, monitor your fatigue, work on strengthening, and you should be in a good position. So like we mentioned, hopefully you guys learned a lot from this video. If you like this button, hit the share, subscribe button, share with friends and family, and subscribe to our channel. And if you have any questions about this, just comment below. We'll try to answer them as soon as possible. We are the Basketball Doctors. Let's ball for life.